Hey everyone, and welcome back to today's Explainer. Today, we're diving into a really fascinating intersection of real estate, social impact, and medical infrastructure. I want you to imagine an investment that actively helps save lives, educates the next generation of doctors, and literally strengthens the healthcare system for an entire nation. Pretty cool, right? Well, that's exactly what we're exploring with the NAHR Hospital and Medical College project in Rawalpindi. It's this uniquely integrated healthcare ecosystem designed to merge top-tier medical excellence with a brand new avenue for investor participation.
Now, it's a really bold premise, right? Can investing in just a single hospital room actually help solve a national healthcare crisis? It completely flips the traditional development model on its head. I mean, instead of sitting around waiting for massive government grants or these giant multinational corporations to fund essential infrastructure, what if that power was decentralized? What if everyday individuals could bridge the gap between private investment and pressing public health needs? Keep that question in mind because it is the driving force behind everything we're about to unpack.
Just look at the projected exterior of the NAHR Hospital and Medical College. The messaging surrounding this project is crystal clear. Invest with the hospital, serve humanity. It's designed from the ground up to be a monumental institution, acting as a guarantor of both health and investment. When we talk about individual participation, this massive state-of-the-art facility standing proud to serve its community is the tangible real-world goal those investments are aimed at building.
To make sure we grasp the full scope of this project, here is our roadmap for today. 1. Pakistan's Healthcare Challenge. 2. Hospital Room Ownership Explained. 3. Professional Healthcare Management. 4. The three-phase master plan. And finally, 5. Impact beyond investment.
All right, let's jump right into Section 1, Pakistan's Healthcare Challenge.
So, there is just sheer compounding pressure on the current system. Pakistan's population is growing incredibly fast, and every single year, the demand for hospitals, qualified doctors, medical colleges, labs, and even just basic healthcare services absolutely skyrockets. Families are desperate for access to quality treatment close to home. And on the flip side, students see more opportunities for medical education so they can actually become the doctors of tomorrow. But despite this massive demand, a lot of areas are still facing a severe shortage of advanced healthcare infrastructure. Now, this is a massive challenge, for sure, but it also creates a unique opportunity to build institutions that serve society while creating long-term value.
Which brings us nicely to Section 2, Hospital Room Ownership Explained.
Okay, so traditional hospitals are usually financed by governments, major banks, or huge corporations. Hospital room ownership totally disrupts this. It's a model where individuals finance specific healthcare infrastructure. Think of it like this. Instead of putting your money into a standard residential condo or a commercial strip mall, you become an active participant in a healthcare-focused development. You are quite literally financing the physical space needed for modern healthcare delivery.
Now, a supernatural question pops up here. Wait, if I own a hospital room, do I have to, scrub in and run it? Absolutely not. There's a strict, vital separation between the investors and the healthcare professionals. As an investor, your role is to fund and own the physical infrastructure. That's it. You do not run the hospital. The day-to-day operations, the clinical services, the specialist oversight, and the actual treating of patients, all of that is managed entirely by highly qualified doctors and professional healthcare teams. Basically, your investment builds the stage, and the medical experts perform the life-saving work on it.
Let's actually picture what this looks like as a tangible asset. We are looking at a 250 square foot premium room, which is really spacious, complete with an attached washroom. And these aren't just empty boxes, they are purposefully designed and prepped for state-of-the-art medical equipment, built specifically to provide premium facilities for patients and their visiting families. You aren't just buying a room, you're becoming a foundational piece of a life-saving facility that's going to serve thousands of patients every single day.
Moving right along to Section 3, Professional Healthcare Management.
Any responsible investor is going to have some valid concerns here, right? Like, will this project actually be managed well? Well, healthcare delivery at NAHRA remains strictly under centralized professional management. The key pillars they are leaning on for success are qualified doctors, experienced healthcare pros using modern equipment, and incredibly robust operational systems. Because at the end of the day, this isn't just about throwing up some walls. It's about building operational systems that guarantee quality, consistency, and ultimately, patient trust.
There's a quote from their vision that I absolutely love, and it really captures this point perfectly. A hospital cannot succeed through buildings alone. It's such a powerful reminder.
Yes, the real estate and the infrastructure, they're the vital foundations. But human expertise, compassion, and professional governance, those are the true heartbeat of any medical institution.
Let's dive into Section 4, the three-phase master plan.
So, an operation of this size doesn't just happen overnight. It is highly strategic. The project is being meticulously rolled out in phases. Phase 1 is targeted for an operational launch in December 2028. This initial foundation is going to feature roughly 300 healthcare units, emergency services, diagnostics, and specialist outpatient clinics. Then, once that's established, Phase 2 shifts the focus to education, building out the medical college to support clinical training, research, and developing that future healthcare workforce we talked about earlier. And finally, Phase 3 aims for completion by 2030, culminating in this massive healthcare city featuring 1,000 beds, advanced specialty centers, and even medical tourism initiatives.
To really wrap your head around the sheer magnitude of that 2030 vision, take a look at this ambitious 60-canal master plan. To put that into perspective, that is roughly 326,000 square feet. You can see the dedicated zones here. The Emergency and Trauma Center right up at the top left, the diagnostics and ICU units right in the center, and these specialized medical blocks sprawling across the entire campus. It's designed as a two-story facility featuring 40 blocks, with each block containing 25 rooms, just to meet that massive 1,000-bed capacity. They've even strategically set aside areas for future expansion. It really is a true healthcare city.
Finally, Section 5, Impact Beyond Investment.
Look, the benefits of healthcare infrastructure like NAHRA extend way beyond just financial returns. The ripple effect here is huge. It creates massive employment opportunities, from top-tier medical staff down to administrative and support roles. It drives profound educational opportunities through the medical college. It drastically improves community healthcare access. And honestly, it results in the most important metric of all, better health outcomes for families. Every single hospital bed, every laboratory, and every classroom contributes directly to a healthier, more prosperous future.
To ensure they actually deliver on this massive promise, NAHRA is built step by step on 5 non-negotiable core principles. Number 1, healthcare excellence, meaning never compromising on patient care. 2, transparency, keeping investors fully informed and secure. 3, professional management, letting the actual medical experts lead the operations. 4, sustainable growth, planning not just for tomorrow, but for 2030 and beyond. And 5, investor confidence, building an institution that financial backers are actually proud to support. These principles are the glue, ensuring they build an institution that patients trust and students deeply respect.
Ultimately, this legacy of healthcare excellence translates to today's trust, tomorrow's best health. It's an open invitation to become part of a secure investment while actively serving humanity at the same time. The future of healthcare isn't built in a single day. It takes vision, commitment, partnership, and above all else, trust. NAHRA represents this really unique ecosystem where private individuals can partner up with medical professionals to build something that will outlast them all.
Now, if you want to dive deeper into project updates, check out detailed floor plans, or learn more about the investment structures, you can get all that info directly at their website, www.NAHRAhospitalandmedicalcollege.com, or you can easily reach out to their team at the contact number we've got right here.
All right, I want to leave you with one final thought to ponder as we wrap up today's explainer. What kind of legacy will your investments leave for future generations? We spend so much time thinking about how to grow our resources, but this vision challenges us to really think about where we grow them and who benefits when we do. Thank you so much for exploring this fascinating healthcare ecosystem with me, and I will see you in the next explainer.